Hey guys, it's Hypno Mark, and I'm back here at Hypno Thoughts 2018 for this edition of Hypnosis Hangout. This edition is special to me. Many of you know that I'm looking for those people who are out in the field, who are talking the talk and walking the walk, who are doing what has to be done to make changes in our industry, to raise the level of what it is that we're doing, and finding niche markets that we can all tap into. One of those today is in the area of medical hypnosis, and where we can work to help as a complementary therapy for healthcare providers, caregivers in the family, and the patients themselves. I'm privileged to be here today with Seth-Deborah Roth, who is at Hypno Thoughts, who's a presenter today, and I'm going to let her tell you about her topic, and we're going to get into where that is. Seth-Deborah, thank you very much.
Hi.
So, what is it that you're speaking about today?
I'm speaking to the idea of using hypnosis for cancer patients in all aspects: cancer pain, nausea, body image, fatigue, even dealing with possible death, and how to handle that, how to talk to people, how to fix relationships, right? Or heal relationships. Right. Sometimes you can't fix them, but you can heal them. And also the family dynamics that go on, because you're not just working with the patient, you're working with their family.
The whole ecosystem.
The whole ecosystem. So you're dealing with the children,
right?
The relatives, the caregivers. That's hard. It's very, very hard. And it's interesting, when I first went into medicine as a nurse, long time ago, but anyway, I went in oncology nursing, and I was young then. I really couldn't handle it emotionally, so I went into the operating room where I had no emotional contact at all, and here I am, full circle, working with people with cancer and their families, right?
Right. For those of you who don't know, within my own family, we've dealt with this, dealing with chemotherapy and cancer, and working within that structure, and helping my wife deal with the anxiety is what brought me to get a greater understanding of how powerful modality that we have as hypnotists to help people improve their lives, deal with the anxiety, deal with the fears that accompany it, and relieve the stress, because stress in itself is enough to kick the disease into play.
Right, and stress has to do with depleting your own immune factors. Right. So even stress stimulates what's called the HPA axis, hypothalamus, pituitary, adrenal, and that stimulates or unstimulates, unfortunately, when you're in stress, the cytokinins and all these good things that help to fight cancer and
right.
help our immune system, that when we're under stress, they just go downhill.
Right.
Right?
So, and when we have stress, we have release of cortisol.
Right.
And cortisol was designed as part of the fight-flight mechanism, and if that's maintained at a high level, it becomes really destructive to the body.
Right.
And that's counterproductive to what we're trying to see done in the therapeutic community to help the patient resolve and the family members resolve.
When you have all this stress, you just get at a certain load where it's called an allostatic load, where you're actually, that's where you are all the time. You need to be down here and having flexibility, but when you're up here, there's no flexibility. You're in hyperstress, and then when you do need your hormones, they're not there because you've been overloaded, overstressed, overtaxed. And it happens to the family too. I know when I worked in oncology, what I did notice is what was going on in people's lives 1, 2, 3 years before they got sick. And it's severe stress that's held in. So I had breast cancer in my family. My maternal grandmother Out of her four, my aunts, three got breast cancer, one got ovarian, which is
Same cancer.
Right, same thing. My mom died at 70, and she never had any mammograms, so we don't know. And then I've had two cousins die from it already, my mom's side, and I think one more with breast cancer. Right. Yeah. So, I mean, it's definitely something that I'm aware of, and I make sure that I handle my emotions. I make sure that I feel my feelings, and I deal with the issues I need to deal with instead of holding it in and letting it eat you up inside.
So, one of the things that as hypnotists, there are avenues and places that we can expand what it is that we do. And in that area is the area of working with the medical community as a complementary therapy. And that's one of the challenges that we face, is how to take and elevate and take the woo-woo factor out of what it is that we do. Because what we do is powerful, and it is therapeutic, and it brings results much more quickly than many other therapies. And that's what makes it so powerful and dynamic.
Yeah, it's getting accepted. I mean, strangely enough, medical hypnosis is more accepted on the East Coast than the West Coast. I now live in San Francisco Bay Area, where you think it's woo-woo, Berkeley, and so forth. The people accept it, but the medical community, it's like banging your head on the wall. The younger guys coming out, they're a little bit more open to it. But it's just interesting. It's you even present the information to them, medically speaking, and they still put up their wall, their barrier. And I remember in the beginning, for me, when I was getting into this field, I had a barrier too. And it takes time to become more open to it, but as they're learning about neuroplasticity, and that is the key to getting to the medical community, speaking their language, and really letting them know that the brain is capable of change, and that it's not rocket science that when you get nervous you feel like you're going to puke, if you're going to give a speech. They understand that, because nurses are more receptive, but doctors, they're still human beings, right? And so if you explain to them, well, we think they're human beings. I'm joking. But if we explain to them, or we even do the lemon test, where you have them imagine a lemon and smell it and squirt saliva, then they go, oh, well, maybe, I get it now. I remember even the first time I saw hypnobirthing, because I'm also a nurse anesthetist. So I worked in labor and delivery, filling epidurals and so forth. And the first time I saw a hypnobirth, it was like eye-opening for me, right? So us medical folks are capable of change. It may take a little longer, but we are capable. And as it comes more and more out there, actually they've changed the Hippocratic Oath, I just learned the other day from one of my students.
Okay.
I can't remember exactly what it was, but it did include this kind of care and caring for the patient as a whole.
Right. And I think that's an important part, that medical science is moving to understanding that it's a holistic approach. If they're going to be successful, you've got to treat not only the disease itself or the condition and the patient, but the patient's environment and family and the whole mechanism that surrounds and supports them. And that's where we come in as well, isn't it?
Because if you have a toxic family environment, that's going to be difficult for your patient. They're going to be secreting all these hormones and what we call neurotransmitters that bathe every single cell in their body. So you've got to deal with that kind of stuff. And when you're dealing with cancer, you're dealing with a whole lot of emotions. It's not unusual when somebody dies, the brothers and sisters are fighting and all that stuff, because it just, everything that's been hidden just boils up, right? So if you can get in there and help those family dynamics, or as simple as giving the history of your family, because once you're gone, right?
Right.
And so I tell people, if you can, have that soul-to-soul talk with your loved one. It's a wonderful gift that you're giving to yourself. Even saying, I'm mad at you that this happened. And now the opportunity is there for the loved one.
And for healing.
For healing. As hypnotists, we know that we can do that afterwards. We could take people to the healing room, right, and have a soul but it's only imaginary, we think. Who knows? But if we could do it when people are alive, imagine the healing that happens, not only for the person who has cancer, but for the family member, to be able to express their anger, their love, their contradiction of emotions. They're saying, I wish we could have done, I'm getting remembering of people, I wish you could have done better, or I forgive you, what you did, how I reacted, it wasn't great, but let's move on from it, and I appreciate you as a human being. I know you were doing the best you can, and I was doing the best I could, and we each were doing the best we could at the time. We just didn't know a better way. And that is, as you can see, is tremendously healing, right? So
it is powerful. What we have is one of the most powerful tools possible. What we do with it sends an incredible message across all fields. What is it that you're doing to improve your game? What is it that you're doing to improve your standing in the community? Hey, I want to thank my guest, Seth-Deborah, for sharing with me, for being open and honest and human. And
we are all human.
And this has been Hypnosis Hangout, and remember, marshal the power of your mind.